A debate beginning in the House on the Republican effort to dismantle the health care law. Some Democratic lawmakers expected to side with the GOP, especially in the effort to remove the provision requiring all Americans have health insurance, a so-called individual mandate. Meanwhile, Blue Shield of California blaming rising health care costs for its 59% hike in premiums and says those costs have no chance of going back down without the mandate. So joining us are two congresswomen from California where those stunning rate hikes are coming. Democratic Congresswoman Loretta Sanchez along with Republican Congresswoman Bono Mack. Congresswoman Mack, I've got to ask you this question about what Blue Cross Blue Shield said today. They basically said, look, health reform essentially needs that mandate. Without it, we can't have the system be floated without that mandate, without reform having that mandate in it. What do you make of what Blue Cross Blue Shield is essentially saying today?
Well, first of all, you know, the mandate is wrong. And we told all of our constituents that we would work to repeal health care, the Obama government takeover of health care. I strongly believe that is the right way to go. You know, right now, this is the heat of the battle. You know, and you're going to hear all sorts of rhetoric on why we should, you know, keep this ObamaCare in place. But let me tell you the truth. The American people know that this is going to be worse health care at a higher cost, pure and simple.
Representative Sanchez, I'm very loath to really take everything insurance companies say right at a face value, because they have made money before this health care bill. They've made money after it. Their stocks in some cases are at 52-week highs. But separate all of the drama that's out there. What is it we need to see here? Some of the issues that are in the bill, in the law, are starting to get implemented. Some have become popular, but this mandatory health insurance is a real sticking point. What do you think?
Well, if you think about it, the health insurance companies hate everything about the health care bill, except the fact that we're telling people that they must buy a health care plan. Now, all of a sudden, that health care company says, oh, this is a requirement, this is necessary, otherwise health care costs will go so high. One of the reasons we said that people should have health care and they should buy health care is that we do need to spread the costs over all of our people. Those people who are not insured, they end up costing us even more than an insured person because they use the highest cost place in the entire system, the emergency room, for their health care, and then it gets passed on to the rest of us who carry health care plans.
All right,
so it's incredibly important. And there are some provisions that have already taken effect in the health care reform that are important. No gender bias. You know, women aren't going to be paying more money than men, as we traditionally have for the same health care plan. Children who have pre-existing conditions, there are no pre-existing conditions anymore for children. And that's important because now parents can put them on their plan.
All right, but let's get to let's get to Representative Bono Mack. By the way, Representative Dan Burton has to have a plan on the table that would allow for reform through the free market system that would bring reform and deliver coverage for pre-existing conditions. But Congresswoman Bono Mack, I want to be clear about what Blue Cross Blue Shield is saying. They're not saying that health reform is a reason for raising the reason they had to raise the premiums. They're saying that they are afraid, they're buying into the Democrats' argument that if healthier people drop out of the system, if they don't have that mandate, then that will cause premiums to spike higher. What do you make of that argument? This is a big insurer saying essentially what the Democrats have been saying about health reform.
Well, first of all, I agree with you. I don't trust them in this at all. And contrary to what my colleague here thinks, you know, government takeover of health care is not the answer. The bill that the Democrats passed, and this terrible bill, it doesn't address the real root of the problem. And let me tell you, my father was a surgeon at USC LA County Medical Center, and I grew up watching him serve the most needy of our community. I know what we need. We need a stronger doctor-patient relationship. Nobody believes that the government takeover is going to cure our health woes. I'm very disappointed, most of all, that the Democrats left out tort reform entirely. You cannot talk about health care reform and not talk about the runaway legal abuses in the system. You know, our country, Americans are over-litigated, we are over-taxed, and we are over-regulated. We didn't do anything to address any of that.
But Congresswoman Sanchez, look, this system is headed for the abyss if we don't do something about what you referenced, and that is people showing up at the hospital door at their very worst, when the foot is falling off from diabetes, when they could have had preventative medicine. Should we not have looked at, specifically started small with preventative medicine and not tried to take off such huge chunks, you know, in reforming Medicare and reforming the medical system?
Well, you know, we do want to do preventative medicine. Look at, for example, how the healthcare reform says to those who are in the Medicare system, the only part of this government reform piece that actually is run by the government. I mean, all the other plans, this Blue Cross or the Anthem that we had last year when they tried to raise rates, all of those are private companies. So when we're telling people go and get health care, we're not telling them go and get United States government health care. We're telling them get it from the private sector. So this is not a government takeover of the health care system. It is simply one in which we're saying the piece that we own, the Medicare piece, we're saying, listen, go and get your mammogram. Okay. Go and get an osteoporosis test. Go and let's do some preventive medicine. That's all free now. Why? Because we want you to get to the problem early rather than later when it costs us all so much more.
Mary Bono Mack, final word. Can you do reform through the free market system?
Oh, absolutely. It has to be done through the free market system. You know, the farther you remove the patient and the doctor from any equation in healthcare, whether it's actually providing healthcare or even paying for healthcare, having a say in how it's provided for, we're going to distort and ruin the system. It has to be done in the free market system.
Okay. All right. Representatives Loretta Sanchez and Mary Bono Mack,
so
good to be with you today. Thank you so much for your time.
Thank you again so much.
All right. There's a new warning out there.